Thank you very much, OS, for giving this opportunity. It's a case of female 21, closed subtrochanteric fracture, where the preoperative access definitely with the mediclaim. So this was the fixation. So we feel like that this is a good fixation. The story is from 2011 to 2025. So wait, there was some pain in the upper thigh healing or healed. That was the question after about 3 months of this surgery. Then thereafter, about 5 months, there was some pain in upper anterolateral trochanteric region, and we could not find out what is the cause. But this was the situation. So what happened, she was counseled to wait for 18 months before removal of implant, because that was the only thought that probably removal of implant will give pain relief. So she waited not for 18, for 19 months, then it was removed. Now, can we see that the pain surface of the implant was removed, so it was decided, and this is the after removal. And now the question was, can she bear weight? So she was allowed, because probably there is no pain now, but thereafter in 1 month time, it broke. And I do not know what is the cause, but it was a tremial trauma. So it was refractured. So pain had not disappeared. And now the pain of subtrochanteric is more. So it was refixed similarly. Probably it was a very good fixation, even the refixation was good. So patient says, doctor, will the old pain go? And then after about 2 months, this was the situation where the pain persisted. We do not know whether it was healing or not healing. So what about the pain was the same question. And so after again about 19 months, the implant was removed because probably it was a pain of the implant only. Now the question is, can she bear weight? And thereafter, again, the pain is still there. So after about 7 months of this second surgery, she was, this was a situation where there was still pain, and then not again, she got the same fracture after even 7 months of removal of implant. And at the same time, there was the same question that will that pain go if you refix it? Because now patient is fed up. So in that case, there were many comments on fixation, but this was the fixation was done. There was a pain. Then there was something like a bone grafting, teriparatide, and everything was given. And there was a question, well, will this unite? And thereafter, it was not uniting, so PRP was injected. And then she was thought that probably there could be some systemic problem because she was fed up with the surgery. So I went into the CT scan, and I'm also referred to an endocrinologist to find out if there is any cause. And all the blood parameters, other parameters were normal. And thereafter, I suggested something like a shortening with some different implants, but then she decided to get it done at her city, and at our colleague in the other city, he did this thing, and thereafter, with the bone grafting anterior plate, there was a mild pain, and then in 2022, 2023, this was united, and this is the latest X-ray where we could see that it is united well. So the question is that this year where we got around March 2025, the last X-ray where it is united. So this was the case where there were multiple times same implant, same fracture, and we could not find out why it was probably healed, but after 7 months it broke away. So the question is it a malunion, delayed union, union, or a non-union? And I coined this as a defective union. So this is basically a defective union where there is a possibility of then pain was a pain of defective union. And then I asked Google about the literature. Hey Google, what is defective union in orthopedics? It says no idea. And this is what my observation is, that always doubt union if no or scanty callus, because good callus is good. Thank you.